Welcome to the Stanford Health Library and Stanford Center for Asian Health Research and Education Community Talk Series. This is the fourth in a series of talks geared towards Asian health for our community. 1 out of 3 patients at Stanford are Asian, and 60% of the world is Asian. Studying Asian populations is uniquely Stanford. I'm excited to present to you today 2 amazing researchers who have made incredible strides in Asian health, Dr. Shehong Chen and Dr. Eric Gross. Dr. Shehong Chen was trained at National Taiwan University, followed by a PhD in genetics at UC Berkeley, followed by a postdoc at Cornell. He has been at Stanford for almost 3 decades. Dr. Chen is a molecular biologist and geneticist at Stanford, and also serves as a director for the Center for Asian Health Research and Education at Stanford. Dr. Chen's research focuses on aldehyde toxicity and the function of the ALDH multigene family in humans. His research is highlighted by the discovery of a class of novel enzyme modulators of aldehyde dehydrogenase. Some of these small molecule modulators are potent enzyme activators for the variant East Asian specific dysfunctional Aldh2, which causes the alcohol-flushing syndrome and affects approximately 560 million people, or about 8% of the world's population. Based on Dr. Chen's discovery and modification, the Aldh2 activator is now in phase 2 of FDA clinical trials. Dr. Chen is currently studying the molecular mechanisms underlying the pathology of human disease associated with aldehyde toxicity and genetic susceptibility of ALDH variation in human populations. Dr. Chen established a Stanford Taiwan ALDH2 Deficiency Research Consortium called STAR ALDH2 Research Consortium in 2015. In 2017, Dr. Chen founded a nonprofit organization in Taiwan called the Taiwan Alcohol Intolerance Education Society, or TASE. Dr. Chen is now actively promoting public health education, cancer prevention, and the awareness of health risks associated with harmful alcohol use and alcohol flushing caused by ALDH2 deficiency in Taiwan and East Asia. Dr. Chen will be joined today by Dr. Eric Gross, MD, PhD, who is a board-certified anesthesiologist that runs a translational research lab focusing on organ injury and anesthetic mechanisms in the School of Medicine at Stanford. Dr. Gross has received a bachelor's and master's degree in biomedical engineering from Marquette University and an MD, PhD from the Medical College of Wisconsin. He came to Stanford for his residency in anesthesia in 2011. His laboratory is funded by the National Institutes of Health and is developing precision medicine strategies for Asian Americans requiring anesthesia, in addition to understanding how a common genetic variant in Asians may impact the health risks of alcohol and e-cigarette use. Dr. Gross is a member of the Center for Asian Health Research and Education and a recipient to study pharmacogenetic in CYP2C19 in Asian populations. He is also a member of the Stanford Cardiovascular Research Institute and on the steering committee for the International ALDH2 STAR Research Consortium. Please join me in giving our world-renowned researchers a warm welcome to our virtual stage.
Hello, good evening. I'd like to welcome everyone and thank Lhasa for the wonderful introduction. And thank you for your time tonight to join with us for this health talk to share our experience with you with Dr. Eric Gross. And so before I talk, I just want to have a disclosure that both Dr. Gross and we are inventors of several patents that's owned by Stanford related to the ALDH2 alcohol flushing enzyme and disease treating. So I just want to get that out of the way and start my sharing to tell you about the alcohol flushing and what's its health implication tonight. I think alcohol is a very interesting subject to all of us. The first slide I want to share with you, just want to tell you that alcohol is such a, a drink that has been associated with human culture and the human history for a long, long time. And this really impact our health as well. I just want to let you know on this, show this on this map. It's the right now it's the world alcohol consumption map compiled by WHO. And so you can see on this slide that almost every part of the world consume alcohol. Currently, there are about 2.3 billion adults in the world drink alcohol regularly. And as you can see on this map, that the deeper blue color is where the alcohol is consumed most. You can see that in a few Eastern Asian countries where alcohol is drank very heavily. And you can see on the bottom, there's a scale that they drink average about 16 liters per year per capita. In the Eastern population, I think there are a few countries that stands out. I want to show you here is that according to WHO, the alcohol consumption has increased the rapidest in the Western Pacific countries, namely the China, Korean, Taiwan, and Japan, and Southeast Asian countries. And here, as you can see that the South Korean probably among the countries that I'm going to talk about with Asian alcohol flushing consume the most alcohols. On the average, they a Korean consume about 10 liters of beer every week. And just let you know that this is a very widely used and really affects our health. And so next slides I want to show you is the, let me see how to advance the slide. I want to introduce you the concept of a standard drink. I think this is used for particular to the Asians. The alcohol it's consumed in different types of drinks. But I think in the US, the NIH, both CDC and also in the American dietary guideline, now we want to actually educate people about how much you drink, and the way to do that is to have a standard of drink. Here in the US, we use 14 grams of alcohol, pure alcohol, as one standard drink. And that's equivalent about a can of beer or a glass of wine and also a shot of whiskey, as shown in this picture. And the reason of this is very important because we need to be aware of how much we drink, not just what type of the alcohol we drink, because each type of alcohol has a different concentration. But knowing exactly how many grams of alcohol drink could be important. And throughout this talk, I will also show you what's the guideline of current alcohol drinking in the United States. Okay, with that, I want to introduce you what is alcohol flushing. And this is very common. I'm sure many of our audience probably experience, mainly when you drink a little bit of alcohol. As I said, maybe one standard drink of alcohol, as I just shown you, about one can of beer or one glass of wine. Within 30 minutes, this amount of alcohol will cause you facial flushing. And many of you experience that, I'm sure, or see your friends, Asian friends, have that symptom of alcohol-induced flushing. Not only that, but usually comes with other physiological symptoms, such as palpitation. That means increased heart rate. Your heart will start to beat very fast 30 minutes after you consume just one can of beer. And then if you drink a little bit more, you will begin to have a headache or vomiting and hangover. And these are the symptoms that comes with alcohol flushing. And today, I think our take-home message for you is to let you know that this, response to alcohol is not benign. It actually, if you have this reaction to alcohol, it actually has implication to your health. That means that you cannot metabolize alcohol properly, and that may affect your health. And so we coined this phenomenon, I'd like to call it alcohol intolerance. And some literature may call it Asian alcohol flushing or alcohol glowing or ALDH2 deficiency. but I think alcohol intolerance is a good name for that. And I show here that comes in different names in different languages. And the reason I picked the Chinese, Japanese, and Korean is because I want to show you that this phenomena is very uniquely to the Asians, that people who have alcohol flushing are largely Asian descendants. Shown on this slide, I want to tell you how common this phenomenon is. Like last I already mentioned that 560 million people in the world have these alcohol flushing reactions. And that is roughly about 8% of the world population. In other words, because there are so many Asians, 1 out of 12 Asians will have this alcohol flushing reaction. And shown here in different countries. In China, roughly 40% of the people have alcohol flushing. In Taiwan, 47%, Japan 30%, and Korean 20%. Even in the South Asia, for example, in Vietnam, there's roughly about 15 to 20% of Vietnamese also have alcohol flushing reactions. And more close to home here, we estimated that in California, at least 1.5 million Californians, East Asians, have this alcohol flushing reaction. And you may ask why only East Asians has this problem. And it is true that you don't find this alcohol flushing phenomena among Caucasians or Latino very often. But you see that mainly in the East Asians, concentrated there, as shown in this map. Now with the DNA sequencing and all the high technology that we can really monitor the DNA composition of different ethnic groups, that ALDH2, the scientists have traced it back to about 3,000 years ago, originated in the Southeast China area as shown in this map. This very, very dark area is where the mutation was originated. The first person who carried the ALDH2 mutation or alcohol flushing originated from there about 3,000 years ago. This is roughly in the Chinese history, if you are familiar with the Chinese history, about the Han Dynasty. And from that, this one single person quickly passed on this gene to many, many of his descendants throughout many generations. Now it's spread out all throughout East Asians, as I mentioned that in China, Japan, Korean, and Southeast Asian. And so many people carry this mutation. In other words, all these people are related, that they derived from this gene from one single person about 3,000 years ago. And the reason that that this gene causes the alcohol flushing, it's because genetically it's a what we call the single nucleotide mutation, as shown in this graph. Showing here is a genetic code that we all have the ALDH2 gene. Everyone, we have 2 copies of this gene called ALDH2 that is responsible for metabolizing alcohol properly. And in the normal subjects, as you can see that the genetic code is supposed to be GAA, which specify an amino acid called the glutamic acid, abbreviated by E here. But on the right-hand side, you can see that for East Asians who have alcohol flushing, they carry a mistake in their genetic code. Instead of a GAA, it now has a mutation. That G has been changed through A 3,000 years ago through that one individual. There was a mutation. That G has turned into an A, and this person now carries an AAA genetic code. And this code now specifies a different amino acid called lysine. It stands by, abbreviated by K. And you can see that because of this mutation and amino acid change, the structure of the ALDH enzyme is being changed as you compare the left structure and the structure on the right. And the result is that the people who have one copy of the ALDH2 star 1 on the left, they are normal. They have 100% enzyme activity. However, if you inherit one defective copy, the AAA gene from one of your parent, you become a genotype called star1, star2, and you will only have about 20% of the enzyme activity left. Now, if you carry both defective gene from both your parents, then you will have, a very, very little or even close to 0% of enzyme activity. Therefore, you cannot metabolize alcohol properly. And Dr. Gross will explain to you how alcohol is metabolized. And because of that, then you will have alcohol flushing. And so this nomenclature now is very easy to be genotyped. Just like, COVID-19, now we all know that there are variants of COVID-19. There are Brazilian, variant. There's a South African variants. And you can read in the newspaper that carry a mutation like a E487K or G305R, something like that. And so this is exactly the same, that in the ALDH2 gene, you carry a mutation. And this gene can be easily checked. Now there are actually quite a few commercial companies that you can send in your sample just in a kit. You can do a spot check of your DNA sequence to know whether you carry the GAA code for the ALDH2 gene or you carry the AAA code that specify the mutated gene. And you can do this very easily nowadays with the modern technology. There are several companies. All you need to do is you can mail in a sample of collected saliva, or they just ask you to do a barcode swab, and you can send in to do the genetic test. So this gene is very easy to check. If you're interested, you can do that. And there's also another very easy way to check that. Instead of a genetic test, if you don't want to spend the money, you can actually do this at home, very easy. An easy way to check whether you have alcohol intolerance or you have alcohol flushing mutation is to apply a few drops of alcohol, strong alcohol, for example, whiskey with 40% of alcohol, just drop on a Band-Aid that you can purchase from any of the CVS or drugstore. Just wear the Band-Aid in the middle and apply that Band-Aid on your skin like a forearm. Apply the Band-Aid to contact your arm for about 20 minutes. After that, if you remove your Band-Aid and check if you have a red spot in the contacted area. If you have a red spot, more than likely you carry that ALDH2 mutation. That means you have the alcohol flushing mutation. However, I just want to let you know that this test is about 70% accurate, not as accurate as a DNA genetic test. If you want to have almost 100% accuracy, the best way is to really do a genetic test. And I'd like to turn now to Dr. Gross to explain to you how ALDH is involved in alcohol metabolism and why this is dangerous.
Thank you, Dr. Chen. So what I'd like to discuss now is just what actually occurs when you drink alcohol and how is it broken down. And so you can see the picture of your alcohol, so just beer. And the first enzyme that metabolizes the alcohol is alcohol dehydrogenase. And this gets metabolized to acetaldehyde. So people who flush that drink alcohol, it isn't really directly because of the alcohol. It's mainly because of the accumulation of the second product, which is this acetaldehyde. And what you can see here is that the acetaldehyde is metabolized to acetic acid. And the way this is metabolized is through the enzyme aldehyde dehydrogenase 2. So when you have a genetic variant in aldehyde dehydrogenase 2, such as ALDH2 star 2, which is the alcohol flushing variant, you flush because you accumulate this acetaldehyde. And that is one of the main reasons why there's this flushing effect with alcohol. So at Stanford, we were really curious to know how much does this impact someone's ability to metabolize acetaldehyde. One of the questions that we wanted to see was if someone had a standard drink of alcohol, what is the impact on the physiology and the amount of acetaldehyde that is accumulated? And so we were fortunate enough to set up a human testing lab where we were able to do this. So this was virtually like a bar inside a controlled setting. And so we put up a flyer, this was before COVID, to try and recruit people around campus. And we were really fortunate with the community outreach with this because someone saw this, put it on Facebook on subtle Asian traits. And we had several hundred email responses over the weekend after the flyer was put up. And so we were able to recruit quite a number of people within this very small study to see what happens when someone drinks alcohol and what the effect is when you have this genetic variant that causes alcohol flushing. So this is the main slide I wanted to share. And so what we did here is we gave someone a glass of vodka with lemonade, and we asked them to drink it over the course of 10 minutes. And then we watched them for the next 2.5 hours. And what you can see is on the y-axis is the amount of acetaldehyde that's produced, is that over the course of this time, those that have this variant that causes alcohol flushing have a quite a marked increase in acetaldehyde levels, so we can measure in the breath. And it takes much, much longer for that level of acetaldehyde to get broken down by the body. And so in the red here are people that only have one copy of the ALDH2*2 variant. So the other copy is the wild type copy. And even just having this one copy causes this large increase in acetaldehyde, both in amount and time. And this is relative to someone who has the wild type enzyme or the ALDH2*1 enzyme, which is blue. So this is quite a marked response, or a large response between the two genotypes. And the other thing we could measure also is we can measure the amount of the amount of heart rate, your heart rate that was actually going on while you were drinking the alcohol, in addition to the cutaneous temperature of your skin. So the temperature of your skin right above your cheek, so where people flush. And the one thing you can see here is that, again, the people who have the alcohol flushing gene are in red, and the people that do not are in blue. And here on the first graph, you can see that the heart rate will increase quite markedly, 20 to 30 points. And anything over 100 beats per minute is considered what they call tachycardia. And so you will actually get tachycardic after a drink. And this will, your elevated heart rate will continue for quite some time. Now, if you look at the individual that does not have the alcohol flushing gene, they have a little bit of an increase in heart rate, but it is not as high or as strong. And this is also similar, the timing of this is also similar to the time when people flush. And you can see that over 30 to 60 minutes after alcohol consumption, you have the most prominent flushing effect. And so it's interesting to see that not only the acetaldehyde level is markedly increased, but this actually causes changes in physiology because of the accumulation of acetaldehyde. So now that we have this human testing lab set up and we're able to do these tests, one of the things I would really like the audience to comment on is the different ways and methods they actually have tried in the past to cut down on the flushing effect from alcohol. I've heard people say, well, I keep hydrated, so I drink a lot of water. Some people say, well, I have a full meal before I have a drink. And then there's other remedies such as Pepsid, which I've heard quite a bit, that people use to feel that they reduce the sensation or the response of drinking alcohol. And so I'd love people to comment if they could about things that they may actually use. And this is one thing that is of interest to us because right now, there isn't really any proven evidence that any type of remedy actually works to decrease the acetaldehyde. And over the next few slides, I'll explain why, even though maybe some of these may help someone feel a little bit better in terms of a little bit less flushing or other responses, it still probably doesn't reduce the amount of acetaldehyde within the body. And this is the important health implication that I'd like to just briefly discuss. And so what are the health implications of inefficient aldehyde metabolism? And so there's been a lot of connections and associations with things like stroke and heart disease and other conditions where if you accumulate or have a higher level of aldehydes, including acetaldehyde, it may lead you to these more susceptibility to these health conditions. And the reason why is really to summarize and bring you back to the slide I already presented, is it's because of the amount of time and the amount of time and the significant level of acetaldehyde that's in your system for quite some time relative to someone who does not have the alcohol flushing gene. And so you can see that this is a several-fold larger amount of acetaldehyde within your system, within your body, over a longer period of time, almost 2.5 hours longer. And what does that do? Well, the one thing that acetaldehyde is known to do is that it acts as a carcinogen. And one thing a carcinogen is very good at doing if it's given the extra time, which is what happens with someone with a flushing variant of the gene, is that it can actually cause DNA damage, which can lead to and promote cancer. And it can also form different adducts on proteins within a cell, which can lead to cellular dysfunction and changes in mitochondrial energetics. So that leads to several potential and risk factors for many different diseases associated with aldehyde accumulation, such as I mentioned, just stroke and heart disease. But the main take home and most of the evidence that we have right now regarding health implications of alcohol consumption and aldehydes is mainly in the world of head and neck cancers and gastrointestinal cancers. And so this is a slide that was from an article by Brooks that shows the risk associated of developing esophageal cancer with alcohol consumption. And what you can see is on the y-axis is the odds ratio or the risk of having cancer. And on the x-axis, it's rated to both genetics and the number of drinks you would actually have a week. And so based on the standard drink, which we introduced in one of the initial slides, less than 3 drinks per week, there's a lower relative risk, but when you consider genetics. But anything above 3 is when you start seeing a marked change in the relative risk of developing esophageal cancer related to genetics. And so again, in red is the people who carry the alcohol flushing gene, and in blue are people that do not. And in relation with odds ratios, these odds ratios presented here are some of the highest you can see in medicine. So an odds ratio of 40 or an odds ratio of 80 are quite high when you look at factors related to risk. And so the other thing that's important is a lot of times when people drink alcohol, they also have a tendency to smoke cigarettes or potentially even e-cigarettes. And this is just a figure by a group with the last name is Cellular a number of years ago, where they were measuring in the saliva of people after they drank some alcohol and smoked some mist cigarettes, the level of acetaldehyde. And what's important here is that a lot of people forget or do not know that cigarettes and e-cigarettes also have a level of acetaldehyde in them. And so a lot of times when you're drinking alcohol and you're smoking cigarettes or vaping, you're going to have a stacking effect of your acetaldehyde. And what you can see from here is that in the open circles are people who just drank alcohol and did not smoke. And in the closed circles or dark circles, you can see that those are people who drank some alcohol and then decided to smoke while they were drinking alcohol. And you can see how markedly and also transiently there's an increase in acetaldehyde every time you smoke. And so one could see and really assume from this that adding this extra factor of smoking with drinking alcohol may increase this risk I just previously showed with esophageal cancer even more. And so there was a very good study out of Japan that actually showed this a number of years ago. And so considering some of the lifestyle factors such as smoking or drinking alcohol, and also looking at genetics such as alcohol flushing, your odds of developing cancer actually stack when you add more of these factors involved. And so just smoking, you have an odds risk of cancer of about 3, just alcohol 3.3. But when you add the two together, it isn't 3 plus 3.3 equals 6.3. It actually gets quite higher, and it gets to 10. And when you actually add the genetic factors involved in it, it could be greater than 100. Granted, this was a very small study, and so the odds ratios that are presented here could be a little bit different if it was a larger study that was performed. But this really shows you and has a large take-home point of these lifestyle factors and what could happen and how risk can be increased for cancer when you keep adding more of these factors in. And the other thing to point out is a lot of times in the United States, we worry a lot more about colon cancer over the last number of years. But particularly in East Asia, one of the highest incidences of cancer for esophageal cancer around the world is in East Asia. And what you can see here is that when you look around the world and you see what the esophageal cancer incidence is, Eastern Asia is actually number 1, particularly among males. And so males are on the blue and females are in purple. And this is likely one of the factors that likely contributes to this is the flushing variant that actually is highly prevalent in East Asia. And the disproportionate amount between male and female is also, there's been several studies done in East Asia, and it does appear that males tend to drink alcohol quite a bit more than females in East Asia. And so this may explain the difference between the male and female incidence of esophageal cancer. However, genetics still exist in the United States, and they also exist elsewhere for alcohol flushing. And so, what you can see with the incidence of East Asia still applies to Asian Americans. And so one of the things that that's really taken hold, mainly in East Asia, is more heightened surveillance for esophageal cancer. And one of the things that in East Asia people do look for is whether or not people have a history of chewing a specific nut that's a carcinogen, a metal nut, or smoking. And if they are identified, if people are identified having these and doing these lifestyle factors, they have more frequent oral exams and exams to look for head and neck and esophageal cancers. So what I'd propose is that we should probably, as Stanford being a center for Asian research and education, really step up our game and try to come up with better screening strategies for Asian Americans for esophageal cancer. And this may involve things like, monitoring more what type of alcohol intake people have, if they do not chew the specific nut, smoke cigarettes or potentially vape with e-cigarettes, and have a deficiency of ALDH2. And this has typically been called by Dr. Chen, my colleague, the ABCD of screening. And I think that we should start thinking about this a little bit more, particularly in the United States for certain groups of populations, because this may be a way to catch a very deadly disease earlier. And at this point, I'm going to turn it over to Jahong, and he'll talk a little bit more about his community outreach.
Thank you, Dr. Gross. Thank you, Dr. Gross, for the wonderful introduction and the explanation to tell us what is Aldh2 mutation and why it causes flushing and why is it so dangerous. As I point out, and also Dr. Gross point out, this is pretty much an Asian-specific mutation, and affected populations really concentrated on the East Asian and also the Asian American here in California, around Bay Area, Stanford. And since I came from Taiwan, I also noticed that Taiwan has the highest prevalence of alcohol-flushing mutation. Based on the most recent genetic database in Taiwan, it's actually as high as 49% of the population has mutation. That's almost like 1 out of 2 people in that place. So we have been doing a lot of public health awareness and education, particularly in Taiwan, also try to do that in all Asian countries. And I hope you will be interested in helping us doing that. Because as we go to East Asian countries, our experience that most of the citizens, people there, still do not understand the danger of alcohol flushing. Most people, when we interview college students or drivers or laborers there, the population, most people don't think much about alcohol flushing as a health risk. They think it's just a cosmetic problem. It's an embarrassing sign that they cannot drink and in front of friends. And so they try to disguise it, as Dr. Gross said, they take medicines. And so we feel there's a need, a great need in the Asian countries to educate people. That's why we started, I started the Taiwan, the Alcohol Intolerance Education Society. Mainly it's to educate people, to tell people what causes alcohol flushing. It's a genetic problem and there's no cure for it. And you should avoid drinking as much as you can. And on top of that, we 2 years ago, we started promoting Alcohol Awareness Day in Taiwan. We called it the Taiwan No Alcohol Day. And we picked May 9th as the day for the National Day of Alcohol Awareness, because May 9th, if you speak Chinese, it means no alcohol, 无酒. 无酒 means no alcohol, that's May 9th. And so each year we begin to educate people and try to promote the alcohol intolerance and danger about alcohol flushing. And we also get the attention of the Taiwanese government. So the government now actually is supporting that in Taiwan. because they are aware that the 50% of its population carries the Aldh2 mutation that's highest in the world. And also because cancer is really a serious problem in Taiwan, not only in Taiwan, but I think also true in Japan for esophageal cancer. And in Korea, the gastric cancer also, I think is related to alcohol consumption and the Aldh2 mutation. So we have been doing a lot of public campaign with the government support to warn people about alcohol flushing, to tell people about alcohol flushing and educate them. And also we want to change the drinking culture there, because in the East Asian or Asian culture is that people feel embarrassed if they don't drink. And so when friends ask them to drink, they very much are persuaded because of peer pressure and cultural pressure to drink. So we are trying to change that culture to tell people that it's okay not to drink, especially if you have alcohol flushing, that you should be able to refuse alcohol drinking. And also government now is endorsing the no alcohol day in Taiwan, and we know it's coming up in May. This year, May 9th, it's also our Mother's Day. So I hope that's something for you to remember also. If you are East Asians, can tell your friends if they flush. And also we try to tell people that drinking less is always better. As shown here, even in the LA Times, now the alcohol flushing is reported in the LA Times to tell people about alcohol flushing, and tell people that this is not something you can change if you are East Asians. We just have to live with it and watch our health. And so if you can not drink, don't drink. And if you have to drink, you should lower your alcohol consumption. Again, now the knowledge, more recent data is that there's really no safe limit of alcohol drinking. As mentioned by Dr. Gross, that people used to think that moderate drinking of red wine it's cardioprotective. It's no longer valid. So this is something we also want to tell people. And lastly, we are active in doing public health education. I go to Taiwan several times a year. Now we have begun to work with the government to incorporate alcohol flushing and the genetic test education in their routine cancer prevention program. The picture shows here that in Taiwan, government is doing oral cancer screening routinely for people who drink, people who smoke, and people who chew the betel nut. They can get free screening. Now we are also incorporating alcohol flushing and genetic screen into this community screening to work with the government. And as you can see that this is a collaboration between government and the nonprofit organization to work together to really do health prevention and health education to the community. And we go to many different areas. The previous picture shows that I go to actually a rural area where there's a lot of high-risk populations, such as truck drivers, hard labor workers, and people who drink heavily. Here's another picture. We go to very actually remote part of Taiwan. It's like a fisherman's village. Now we go there with the medical team of a hospital to go there to service them, to do routine health check, and also to incorporate now alcohol flushing education and test in these communities. And we hope that by this, we can really apply what we learned in our health knowledge into the community and initiate a new policy with the effort of Stanford, our East Asian Health Education Research Center, to change some policy and prevent cancer. And we hope that this effort can be adopted in many countries and areas in the East Asian or Southeast Asian. And finally, we are actively conducting research to learn more about the risk of alcohol flushing and what are other health risks we need to watch out for. And so there's still a lot of research to be done. And we host together with Dr. Gross and Dr. Mosley Rosen here from Stanford and Dr. Anshin. We host annual Aldh2 Research Consortium in Taiwan and also at Stanford. And this is the one that we held 2019 in Taiwan before COVID-19, with the participation of actually Vice President of Taiwan, who is actually a public health expert and also works on the liver cancer and alcohol drinking issues. So we were very happy that the government is paying attention and want to collaborate with our effort. And at the end, I just like to thank everybody's attention. I'd like to acknowledge the people in Dr. Gross's lab and Dr. Gross's help with all this. And I'm from Dr. Mosley Rosen's lab from Stanford University. And also I want to thank the Taiwan Alcohol Intolerance Education Society. Many doctors and medical students and volunteers are helping our efforts to do education and public health prevention. And so we would just like to stop here and open for questions. And thank you for your attention again.
Thank you, Dr. Chen. Thank you. We have almost 70 people joining us on the chat, and thank you for your questions in the Q&A. Dr. Gross wanted to answer this question live, so I'll go ahead and ask it first. If you have alcohol flushing, can you drink less than other people? Some of my friends who have flushing can still drink a lot, but personally speaking, I get alcohol flushing and I cannot drink a lot. And in answer to Dr. Gross's question, I'll sort of group these questions together about what people are doing to prevent the flushing. One of our attendees reports taking Pepsid and antihistamine 30 minutes to an hour before alcohol intake, with a meal preferably, which you also mentioned, Dr. Gross. And I'll group these questions again. One of our attendees reports they have a flushing problem and they're wondering if there's any good solutions for people like me who enjoy drinking. Dr. Chen, I think you addressed that a little bit, but maybe you can both say a little bit more, because these are a lot of the questions that we're getting from our attendees.
Sure. I can start. The one thing is that there's always different remedies that people think will work for to cut down on alcohol flushing. And the one thing to really bring across here, and the one message is that whatever alcohol you take in will get broken down to acetaldehyde, and that acetaldehyde will accumulate if you have the flushing gene. And so no matter what type of remedy you take at this time, if it doesn't directly change the activity of that enzyme that breaks down acetaldehyde, there is a low likelihood that it will protect you from potential health implications of consuming alcohol. However, with that said, the one thing that is known in the alcohol literature is that people who have a full stomach or have a full meal will metabolize alcohol a bit slower. And so you won't modify the conversion of this acetaldehyde to acetic acid, but you may actually have the alcohol getting put into your body a little bit slower by being digested a little bit slower with the extra food and such. And so potentially that may help a little bit. In terms of something to potentially do to or medication to help with treatment, there's a lot of potential remedies out there, but none of them, as far as I know, are scientifically proven to reduce that level of acetaldehyde if you take it, that are clinically approved.
Great, and we have, Dr. Chen, anything you want to add to that? And I'll ask this question because it's a good follow-on. Andrew is thanking you for your informative talk. What is the future outlook on this important health issue? Do you suppose a medication will be available to help process alcohol for the affected individuals, like in the case of lactose intolerance? What is the projection on the prevalence of the gene in question in the future? Dr. Chen, do you want to start?
Yes, in terms of medication, we really want to develop a medication to address ALD2 deficiency for real medical needs. for example, there are diseases that are clearly associated with ALDH deficiency, such as cancer. Of course, we want to do prevention. And we know that there are some rare diseases or other diseases that are clearly pointing that the alcohol toxicity is an issue and causes diseases. We like to do that. We certainly don't like to have some remedy that can address the social problem of enabling people to drink, because we worry that they might have some social issues related to that. And so I think we need to advise people, really, if you have ALDH deficiency, the best way, the remedy is really not to drink, or drink in a very limited amount. That's really the best advice we like to give to people.
Okay, so wonderful. Thank you, Dr. Chen and Dr. Gross. So one of our attendees is Gayla Wang. Thank you for your question. Are there any benefits to having this mutation besides a healthier liver? Like sickle cell anemia and malaria, is there, perhaps a beneficial effect with this founder mutation?
Mm-hmm. Yes, we believe that there must be some benefits having this mutation. Otherwise, we keep wondering why so many people have it. This is probably one of the most common enzyme deficiency in the world, in the human population. And we have a few suspicions, but really right now, medically, there's no scientifically proven evidence to show that that having this mutation clearly, really, of course, one is that you avoid drinking. That's one clear benefit, that is that people are not pleasant drinking alcohol, large amount of alcohol. And so that's clearly, we know that maybe it's a protection mechanism to prevent this group of people not to abuse alcohol. That's clearly shown that very few people actually become alcohol addiction compared to not having the mutation. But we also suspect that this might, protect the human population in some infectious disease. But again, these are all hypothetical and speculation, because we believe that a mutation in such a large scale must be protecting the human race against a very important disease, and most likely it's an infectious disease. That's all we know for now.
Great, wonderful, thank you. Dr. Gross, anything to add? Or
I have a different potential idea, and that is we actually know when food goes bad, it actually spoils, right? And so if you actually have fruit that spoils, it turns into alcohol. And so perhaps this genetic variant actually gave people an advantage for hundreds of years of not eating bad food. And it could just be simply something like that could have actually made this such an important gene to pass on over the years.
Yeah. Avoiding sickness. Okay.
Right.
Interesting. Yeah. So to be studied still, I guess. So Anne Pianetta asks, can you be tested to see if you have this variant? If so, where? And I know, Dr. Chen, you had some slides on a slide on this. Would you like to tell the group where you recommend perhaps the people be tested, other than the sort of swab test with alcohol that is 70% sensitive?
I think in terms of recommendations, in general, we don't have any recommendations of any specific company or organization to get tested for. The examples we put up on the slide were just examples of places that we know that will test for this specific point variant. And so the one thing that to know is that it doesn't check the whole ALDH2 gene. It does not sequence it. It really just spot checks it for having this genetic variant.
I see.
And so there's many different companies, and the best way to look is really just Googling it, to be honest. And you can find a different variety of places that can test for this. And all the tests are genetic that I'm aware of. And they are all So they all are just looking for that the specific variant.
So with a saliva swab, something like that.
Right,
Yeah.
right, with the
Yeah.
saliva swab.
And I may also want to add that many people ask, so what's the advantage of having this test? Why do you want to get it tested? Of course, number one is that you will know very specifically you carry this genetic mutation or health risk or not. But from conversation in Taiwan I have, many people say, well, I know if I flush, I have it. If I don't have it. Why bother to do genetic test? So number one is that, as I mentioned, that this flushing is not 100% accurate. It only, it's like 70% of the time is accurate. Number two, in Taiwan, I know many people, especially among the medical community, I have doctor friends asking me, saying, oh, I'm suffering because I know I have this mutation. But I like to get genetic tests so I can actually be certified. And next time when my friends ask me to drink, I can really tell them, say, oh, I really actually did a genetic test. I carry this health risk. So, don't ask me to drink. So that's maybe one of the advantages I have heard of.
That's a great point, Dr. Chen. Thank you for sharing that. So final question, and this gets into the genetics a little bit. An attendee asks that both of the grandfathers were able to drink without any flushing. Both the parents had Asian glow. Sister and I have alcohol flushing. Maybe if you want to just talk about how this risk is passed down through families, that in this case, the grandmothers may have had the variant that was passed down potentially. If you want to talk a little bit about that. Dr. Gross, do you want to?
Yeah. Mm-hmm. I think the one thing that's interesting is at times I will ask people their alcohol habits, and I'll ask if they, do you flush when you drink alcohol? And the typical response I get, which was sort of unexpected, was people will tell me, I don't drink. and so with that answer, you don't really know if someone has this flushing gene or not if they don't drink. So sometimes you have to ask a further question is, did you ever flush when you ever had a drink of alcohol? And sometimes you can uncover things a little bit more. But based on the genetics, I mean, what would be expected here is that you get one copy of this gene from each of your parents. And so the idea here is that if one person has it, they will, and if one person has it, they probably have one copy of the flushing gene and one copy of that does not cause flushing. And so just depending on which one is chosen based on, I guess, the lottery or whatever, you will either get that one or the other one from your parents. In terms of the genetics, what's interesting about this is that there are less people that have two copies of the flushing variant than would be expected from regular genetics. And so that may suggest that there is a little bit of a genetic disadvantage if you have both. So most of the time when we talk about lineage and how this goes through, usually your parents or your grandparent will likely have one copy of the flushing gene and one that's a non-flushing copy.
Great, thank you, Dr. Gross. Dr. Chen, anything to add?
No, I think that Dr. Gross said very well. That's so, as I say, if your parents is a carrier, you have 50% of the chance of getting one of that defective gene. But if your parents are carrying both defective gene, that means for sure you will get at least one. And in this case, one defective gene is sufficient to cause alcohol flushing.
Right. And that's another reason that the genetic testing would be helpful to know if you have one or two, and for your parents as well. Well, thank you so much to you both, Dr. Chen and Dr. Gross. This has been very enlightening. We've had lots of audience engagement and great participation in this session, so thank you. We will ask you back because there's lots of interest in this area, and we want to hear a little bit more about how your research has been progressing in this. And I would like to thank the attendees. We're right at the top of the hour. In the chat, we have the link if you want to attend future events. So this is a monthly series, a collaboration between the Health Library and the Center for Asian Health Research and Education. And next month's talk is going to be on Tuesday, May 18th, and it will be on pharmacogenetic testing in healthy populations. Is it ready for prime time? So thank you all for joining today, and we'll see you next time. Bye.